Hi everyone, Dr. Emma 4-Acre. So today I want to show how I'm going to numb up for threads in the neck. So today we're going to do 2 threads on each side of an 18 gauge cannula thread. So what I want to show first is how I'm going to numb. I've previously not numbed well enough for this procedure, so I'm working on my numbing technique, and threads can be a little uncomfortable. Obviously topical numbing is not going to be enough. So first I'm just marking where I want my threads to go, because I'm going to numb with little aliquots of lidocaine all along each line where I'm going to place the threads. I used to only numb the pilot hole, and obviously that's doesn't really help with the discomfort of the cannula finding its way under the skin. So first I am doing that. Probably should have gotten my lidocaine prepped before I decided to film myself. I realized I could stop the video, but I'm not gonna. I'm just gonna do it really quick. And so I'm just gonna use a 1cc syringe, an 18 gauge needle to draw up the lidocaine, which the 18 gauge needle will then be used as my pilot hole maker for the cannula. And I have 2% lidocaine without epi. It doesn't really matter if you use with epi or not. Epi is sometimes helpful with threads because then it can help with the bleeding, but it's not necessary for sure. And so next, I'm taking my 30 gauge needle for injection of the lidocaine. And so then we go ahead and numb our patient. So I'm literally gonna numb right here where the pilot hole is gonna be, and it's gonna be a good aliquot right here. And then I'm also gonna numb down the line of where I'm gonna place the thread. So I'm literally going in as deep as to the subcutaneous tissue, because that's where the threads are going to be going into, and I'm just following the path of where the needle is going to, or sorry, the cannula is going to go. So that's how you numb. I'm going to do the other side and along the second thread's path, and then I will start the camera again once I'm actually placing the threads. Okay, so we've let the numbing sit for quite a while now, so we're going to get started with the procedure. There's somebody that bruises really easily, I have to say. How can I fix that? You can't. It's okay, it's not a bad thing. It's just, I'm surprised that just a little bit of numbing bruised you. Okay, so if you can see here, we're going in with our pilot hole, and she's going to be really numb. She's not going to feel it at all, so don't worry. And so this is where I made that initial wheel or aliquot of lidocaine injection. So here comes a little poke here. And so then I like to make sure that I'm kind of opening up that track, so I kind of go down and a little to the side, so that's plenty for the pilot hole. I have my threads, and so now that was the worst part, because now she's going to be super numb. This cannula obviously is a blunt tip cannula, so we just have to let the tissue tell us where to go. So I'm always feeling that I'm in the right plane. Faith has really thick, healthy tissue, but it's very hard to get through. Okay. So as I pull out, I am engaging the skin onto the thread. Are you okay?
Mm-hmm.
Okay. I really like to try to pull the skin and really get those barbs to pull that tissue. So I'm going to use the exact same cannula, the exact same pilot hole, but I'm obviously going to go a different vector this time. So I'm going down this way as opposed to down this way. If I can feel the end of my cannula here, I'm pulling that tissue up onto the barbs and pulling out. Now I'm going to let it sit for a second for hemostasis purposes. Sometimes, if I really want to get a good lift, I will take the threads and anchor them together, so I will tie a knot. And you can see when I do that, it really snatches everything up. And then you just bury the knot in the skin. And I think that just anchoring point is, because we have two threads in two different planes, and then you tie them together, now you've got, more, instead of just having the threads coming out of the skin and then they don't have anything to anchor to. So I'm going to go all the way down to the knot, snip, and then I kind of do this motion here to then bury the knot. Ooh, that's a good one. That was a good one. Okay, I will show the other side as well. Okay, now we are doing the other side. Here's a beautiful view of Denver today. Okay, and same thing. So the pilot hole was made, or sorry, I keep saying pilot hole when it's not. The first wheel of lidocaine was made here. I always squeeze when I'm using a cannula because you got to find where that hole is, and it will run away from you if you don't keep an eye on it. So that little spot of blood tells me where my pilot hole is. And so when I go into the hole, you kind of do in and then down, and that makes sure you're in the right layer. You just let the cannula show you where to go. You don't want to ever push hard. Obviously, there's structures in the neck that you do not want to puncture through, but when you're in the subcutaneous tissue, the patient will seem pretty comfortable, and that's because they are. Never mind, they're not. She made a noise. So I'm finding the edge of my cannula here. That's perfect. I'm just really twisting and engaging, and then before I do anything, I pull up on that skin because we want those barbs. Oh, and I can feel the barbs engaging sometimes. You can actually feel the clicking of the skin getting pulled up by the barbs. And then same thing, I've heard it's called like lifting up the cat's tail to go to check their temperature. That's what this is. You pull up here. That's from a mint provider. I don't remember her name. So same pilot hole again, but different vector. So this one was this way, this is this way. Oh yeah, we're gonna get some good results today. I'm gonna have you look a little bit that way, thank you. So I find always feeling for the tip of my cannula right here, but I do want to kind of overlap to the other side a little bit. So I really want to grab that submental fat and just snatch the fuck out of it. Out of Faith's neck. That's what I mean. Okay. And then twist, engage, and I could feel the barbs popping into place. Oh my God, Faith. Oh my God. We hit a home run with today's session. That was that. So it looks so freaking good. Oh my God. So now again, I leave it in for hemostasis because we didn't use epi in this round, but that's okay. You know, these gauze, I shouldn't use gauze because it always gets pulled. And then same thing. I like to tie the anchor. You can even see the tissue when I pull up. It just slurps right up. I don't know why whenever I talk about snatching the neck, I think about it in a slurping sound, like it's just, that's just what it is. You see, do you feel that, Faith? Does that seem reasonable that I think about it like that? Okay. Cut the knot right at the knot. We don't want anything poking out on her because this is going to be, these sutures are going to be in there for the, you know, at least a couple months. So then I pull and, hold on. Where's, that's right. And bury the knot. Wow, that's nice, and I cannot believe we did not take before and after pictures. I am the dumbest person in the world. But anyways, if you have any questions about thread lifting of the neck or face, please let me know in the comments below.